Hi, welcome to my Unit 8 clinical presentation case study on a 32-year-old female named Elsie. She is 175 centimeters. She weighs 53.6 kilograms. Her current BMI is 17.4. Her usual body weight is 61 kilograms, while her ideal body weight is 66 kilograms, and she's recently traveled to Mexico to a remote village. She's currently presenting with a few months of abdominal distension, a loss of appetite, 16-pound weight loss, nausea, epigastric pain, and a recent onset of vomiting. She has a recent development of a headache, cough, diarrhea, fever, night sweats, rash on her legs, and general malaise. Once at the hospital, she developed hypotension and a pulmonary edema. Her social history includes the fact that she is an archaeologist, meaning she spends a lot of her time underground. She's single, she's vegan, she doesn't use tobacco or drink alcohol, she exercises daily, and while both her parents are deceased and we don't have a lot of information on their family history, we do know that rheumatoid arthritis was present on her maternal side. Her medical and surgical history includes her insomnia, ADHD, hyperthyroidism, pancreatitis, chronic back pain, a vitamin D deficiency, type 1 diabetes, vitamin B12 deficiency, Crohn's disease, pelvic fracture and rotator cuff injuries, and a terminal ileal resection secondary to Crohn's disease. Her previous medication includes Vyvanse for ADHD, and she's been taking that for over 15 years. Levothyroxine, which she takes for hyperthyroidism, and she's been taking that for 3 years. Vitamin B12 for her terminal ileum resection and her vegan diet, and that's been for about 12 years. Cimzia for Crohn's disease, also for 12 years, and multivitamins and minerals as a supplement for 5 years. The hospital procedures that she had when she entered the hospital included an abdominal x-ray, and that showed multiple loops of the small bowel, air tubular structures projected over the small bowel, and a dilation of the stomach. The abdominal ultrasound she had showed non-peristaltic dilated loops on the small bowel, as well as curvilinear structures moving independently. And her abdominal CT scan showed tube-like structures on the small bowel, a mass in the distal jejunum, wall thickening of the terminal ileum, and small bowel obstruction secondary to ascariasis ischemia. The hospital surgery that she underwent was called an exploratory laparotomy. And with this laparotomy, she had the 100 centimeters of the proximal jejunum resected because it was found to be necrotic. She had an Ascaris roundworm that was between 12 and 38 centimeters with a 3 to 7 millimeter diameter found. Her duodenum was removed, and that measured 22 centimeters. 100 centimeters of the jejunum was removed, and an anastomosis was created. Her lab results showed that she had a low potassium level, which could be due to dehydration. She had a high chloride level, which could also be due to dehydration, but could also be a potential kidney issue. She had a high creatinine level, which is also related to a kidney issue. She had a low creatinine clearance, which could also be related to a kidney issue. She had a high white blood cell count, which generally indicates an infection. She had a low hemoglobin level, which usually is indicative of low iron, probably due to her vegan diet. She also had a low hematocrit level, which is also probably due to her vegan diet and having low iron levels. She also had a low red blood cell count, which again is most likely indicative of a vegan diet and not getting enough iron in her diet. She had a high vitamin D25 hydroxy level, which could be indicative of vitamin D overdose, maybe because of the supplements that she's been taking. And finally, she had a high C-reactive protein level, which generally indicates inflammation in the body. The primary diagnosis that she received is a hantavirus pulmonary syndrome, valley fever, and small bowel obstruction secondary to ascariasis. Her secondary diagnosis includes profound protein-calorie malnutrition. The hantavirus pulmonary syndrome is generally caused by exposure to aerosolized dry feces and urine from animals in the Muridae family, and this is most commonly found in rural areas, especially those in Central and Latin America, as well as some southern places in North America, including New Mexico and the southern U.S. states. Her symptoms of the hantavirus pulmonary syndrome include hemorrhagic fever, renal syndrome, fever, malaise, headache, cough, nausea, vomiting, and GI distress, of which Elsie presented with many of these. Patients also have an increased white blood cell count, which Elsie had. Patients develop a pulmonary edema and hypotension, which she did when she arrived at the hospital. And no antiviral medication is available. Patients need to stay in the ICU, and they generally need to go on a ventilator. Valley fever is a fungal infection caused by contaminated soil. The symptoms of valley fever include a cough, fever, night sweats, malaise, rash, headache, and fatigue, in which Elsie presented with all of these. And the treatment includes fluconazole, which is prescribed for the rash, and other treatment options just include lots of rest and plenty of fluids. The small bowel obstruction secondary to ascariasis is an infection caused by a parasitic roundworm, usually from contaminated drinking water and soil. The symptoms include abdominal pain, constipation, nausea, and vomiting, and it's commonly found in individuals who travel to third world countries, rural areas, and those who have GI issues such as Crohn's disease. It can be treated with anthelmintic drugs such as ivermectin and in severe cases, surgical resection. The profound protein-calorie malnutrition is a long-term deficiency of macro and micronutrients due to vomiting, loss of appetite, and an inadequate diet. Patients develop edemas, skin atrophy, and hair loss, and the treatment includes increased feeding and parenteral nutrition. Not enough iron intake as related to a vegan diet, as evidenced by a lower than normal hemoglobin level and a lower than normal hematocrit value. Lack of protein in the diet, as evidenced by protein-calorie malnutrition and vegan diet, as evidenced by kidney disease indicators of higher than normal creatinine levels and lower than normal creatinine clearance rate, and a higher than normal BUN level. Lack of iron and protein-rich foods as related to a vegan diet, and protein-calorie malnutrition as evidenced by a lower than normal red blood cell count. Excessive vitamin D intake as related to a higher than normal vitamin D hydroxy 25 level, a multivitamin that might contain too much vitamin D, and a potential kidney issue as evidenced by a high vitamin D hydroxy level, excessive creatinine level, and a low creatinine clearance rate. Malnourished as related to small bowel obstruction secondary to ascariasis, as evidenced by travel to a remote village, poor appetite, nausea, and vomiting, as evidenced by a 16-pound weight loss, roundworms in the jejunum, and a mass in the duodenum. Lack of adequate nutrition and malabsorption, as evidenced by vomiting, poor appetite, and terminal ileal resection, as evidenced by a 16-pound weight loss, low hemoglobin, and low hematocrit levels. The new medications she was given at the hospital include the fluconazole for the leg rash, heparin for the disseminated intravascular coagulation, ivermectin for the parasitic infections, omeprazole for reducing stomach acid, loperamide for diarrhea, cholestyramine to help with bile acid resins as a result of the ileum resection, magnesium oxide to help with abdominal distension, famotidine to help with antacid activity, and 50,000 IU of D2 weekly for 8 weeks to restore levels. The nutrition plan for Elsie includes An increased nutrient intake, especially focusing on getting enough fat and protein in her diet to help her overcome the protein-calorie malnutrition. She should also consider adding more supplemental vitamins to her diet to ensure her nutrition goals are met, especially because she is vegan. Since Elsie had her duodenum removed, as well as a section of her small intestine, she should continue with enteral feeding to ensure she is absorbing all the nutrients she is ingesting for the first 7 to 10 days to alleviate some of the stress of digesting food on her body. Given Elsie's surgical removal of her small intestine, she needs to ensure she continues to absorb nutrients once she resumes eating food again. And to do so, it is recommended that she chew her food thoroughly, eat smaller, more frequent meals, consume high protein and low sugar foods. The increased protein is good for her vegan diet as well as slowing the movement of food in her system, and eating less sugar will help with her diarrhea issues. She should also continue taking her multivitamin and B12 supplements. In conclusion, Elsie was released 1 month post-hospitalization. She is currently scheduled for a bowel transplant. Her long hair grew back and she regained 10 pounds of the pounds that she had previously lost. She continues working with a dietitian and seeks out sunlight to help with her job as an archaeologist. And she will continue with supplements and medication to help with her diagnoses and her vegan diet. Thank you.